The Arizona Healthcare Cost Containment System, or AHCCS, is Arizona's Medicaid program. It provides comprehensive healthcare services to eligible residents. AHCCS aims to deliver quality healthcare while controlling costs. The program serves low-income individuals, families, and those with disabilities. However, recent developments have cast a shadow over its operations. Allegations of discrimination against Black-owned healthcare providers have surfaced. These accusations have sparked a debate about systemic racism within the healthcare system. The controversy raises questions about the equitable distribution of resources. As we delve deeper, we'll explore the various facets of this crisis. We'll examine its impact on communities, businesses, and Arizona's healthcare landscape. Reports have emerged of AHCCS targeting Black-owned behavioral health and substance abuse providers. These businesses, serving vulnerable communities, face unprecedented scrutiny. Black-owned companies report more frequent audits and delays in reimbursements. Some have had contracts terminated without clear explanations. These actions have placed immense financial strain on these businesses. Black-owned business owner. The impact extends beyond the businesses themselves. Many serve predominantly minority communities, providing crucial culturally competent care. The targeting threatens to create a gap in services for these communities. Critics argue this reflects deeper systemic issues within AHCCS. They point to a lack of diversity in decision-making positions. The situation has sparked calls for a comprehensive review of AHCCS practices. Advocates demand greater transparency and accountability in the agency's operations. The targeting of Black-owned health companies has far-reaching consequences. Arizona has seen a significant increase in homelessness, particularly among those with mental health and substance abuse issues. As treatment facilities close, many patients find themselves without support. Drug abuse rates have spiked, with fewer treatment options available. This has resulted in a rise in overdoses and drug-related crimes. Arizona is now experiencing its highest eviction rates in a century. Many, unable to access necessary treatment, struggle to maintain employment. This has led to a cascade of financial problems, with many unable to pay rent. The eviction crisis disproportionately affects low-income and minority communities. The interconnected nature of these issues has created a vicious cycle. Homelessness can exacerbate mental health and substance abuse problems. Local governments and nonprofits are struggling to cope with increased demand for assistance. The crisis has taken on a political dimension with an investigation into Governor Katie Hobbs. Allegations suggest certain facilities received preferential treatment in exchange for political support. The investigation examines whether Governor Hobbs influenced AHCCS decisions. Governor Katie Hobbs. The scandal raises questions about the integrity of Arizona's healthcare system. Many are calling for a thorough and independent investigation. Investigative journalist. The investigation has broader implications for healthcare policy in Arizona. It highlights the need for greater oversight and transparency in healthcare administration. The scandal has sparked debates about campaign finance reform. Many are watching closely to see how this investigation will impact Arizona's healthcare future. Voices from the front lines, business owners, speak out. The crisis has deeply affected Black business owners in the healthcare sector.
We're facing constant audits and delays in payments.
Dr. Alicia Johnson describes the challenges she's faced.
We've had to lay off staff and cut services. Our patients are suffering.
Marcus Thompson shares a similar story. These accounts paint a picture of systematic discrimination. Legal battle. The upcoming class action lawsuit. A group of affected business owners is preparing a class action lawsuit. The lawsuit challenges AHCCS's practices and seeks justice for those impacted. It alleges systematic discrimination against Black-owned healthcare companies.
The lawsuit argues that AHCCS's actions violate anti-discrimination laws. It seeks compensation for financial losses and demands structural changes within AHCCS.
Legal experts suggest this could be a landmark case in healthcare administration. Lawyers have been gathering evidence and testimonies from affected business owners. The legal team believes they have a strong case that will expose systemic issues within the agency. The lawsuit has garnered support from various civil rights organizations. They hope a favorable outcome could set a precedent for other states. The path forward. Addressing systemic issues in healthcare. There's growing recognition of the need for systemic change. Experts argue that addressing immediate issues is not enough. They call for a comprehensive overhaul of healthcare administration in Arizona. One key focus is increasing diversity and representation within AHCCCS leadership. Advocates push for programs to recruit and promote minority professionals. There's also a call for mandatory diversity and bias training for all AHCCCS employees. Another proposed solution is the creation of an independent oversight committee. This body would monitor AHCCS operations and investigate complaints of discrimination. Supporters believe this could help restore trust in the system. There's also a push for greater transparency in AHCCS operations. Conclusion: a call for change and accountability. The crisis facing Black-owned healthcare companies in Arizona is complex and multifaceted. It touches on deep-rooted problems of systemic racism, political accountability, and healthcare equity. The consequences extend far beyond the affected businesses, impacting entire communities. The ripple effects include increased homelessness, rising drug abuse rates, and record-high evictions. These issues disproportionately affect minority communities. The political scandal surrounding Governor Hobbs adds another layer of complexity. The upcoming class action lawsuit represents a crucial step towards accountability. However, legal action alone is not enough. A comprehensive approach is needed. Only through concerted effort, transparency, and a commitment to fairness can we hope to create a healthcare system that serves all members of society equally.